In this video, I will explain why the best way to start preparing for a medical emergency is by means of building a medical supply kit for your home or car. We usually underestimate the importance of simple, over-the-counter medicines like ibuprofen and Benadryl until we have a headache or an allergic reaction. What about more critical items such as antibiotics, a suture kit, or prescription medications you rely on? By the end of this video, you will have a complete list of every single item that needs to go into your medical preparedness bag. I'll also be mentioning my top add-ons for when things really go south. We'll also touch on expiration dates, essential antibiotics, and how to get a stockpile of other medicines that you may be taking on a daily basis. What's up, preppers? I'm the Community Prepper, and thank you for watching my channel. Please hit the like button, subscribe to my channel, and if you like content like this, please hit the notification bell to be notified when I release a new video. Disclaimer, I am not a doctor. All advice I state in this video is not how to diagnose, treat, or cure any ailment. This is a video about educating yourself on what precautions you might take if you want to be prepared for a medical emergency. If supply lines stopped or got delayed and you need simple over-the-counter medicine, will you need to run to the store? What if you are on the road and you come across a situation where you or a stranger needs basic medical help? Like most things in prepping, it's easiest to go purchase them when the things are calm, rather than panic buying when the stores are mobbed. During my prepping journey, I have never found a complete medical type kit that I thought was sufficient or diverse enough to cover a slew of ailments. One, as mentioned before, extreme shortages and supply lines. Two, a long-term natural or human-caused disaster. Three, being far from emergency help when you have everything you need to diagnose, treat, and hopefully cure the ailments at home. And four, if it's a complete grid down SHTF scenario. For that reason, I have created my own emergency kit that I believe will get me through most disasters. Of course, we're not talking about open heart surgery or removing an appendix in this video. To cover those areas, you'll need to refer to your mutual assistance group, or MAG group. A MAG group are people in your neighborhood or prepping community that pool their resources and skills for the betterment of the group. Talking about a mutual assistance group will be a video for another time. Before we dive into my medical bag, I would like to mention the best, most informative book to read and keep on your shelf if you need to step up and take control of your own medical needs. It's called The Survival Medicine Handbook, the essential guide for when help is not on the way. It's written by Amy and Joseph Alton, and these authors have thought of everything, and I mean everything you'll need if we all suddenly become 100% reliant on ourselves for any medical emergency situation you can think of. I'll link the book in the description below. So let's get to it. What are the supplies and skills that you'll need to be best prepared for a minor boo-boo or to stabilize a broken bone? What are the must-have items to keep in your home or car that could save yourself or someone on the road who isn't as prepared as you? Let's pick apart my medical bag and go over each item. Before you, you're seeing a pretty good collection of medical supplies. Most of this stuff will be over-the-counter purchases. Instead of telling you what everything actually does one by one, I'll place a link to download 2 PDFs you can print out. One PDF will be an inventory list of everything that's in my bag. The other will be a list of what each substance does or treats. All right, preppers, this is my medical emergency bag. This one is the actual bag that I keep in my car at all times. We'll go into storing medicine in your car later in this video, but for now, I just want to show you this bag. It is a simple medical bag that I bought on Amazon, maybe $20. Opens up, it has a large compartment there. It has pockets on the sides, pockets on the back, pockets on this side, a handle, and a shoulder strap. Pretty simple. Let's pack everything away now. All right, so we're gonna pack this up. We'll open up all the compartments and we'll put things away as neat as we can. Now, The way you pack your bag is going to be up to you. There's really no right or wrong way to do it, but let's start this. First thing is gauze. I have 1, 2, 3, 4, 5 different things of gauze. Just going to place it in the outer compartment. Next are ACE bandages. If you sprain an ankle, these are going to be awesome if you're out on the road. Hand warmers. Some creature comforts are also nice to have in a medical bag. 2 more unrelated objects. Motion sickness tablets and vinyl gloves in case you need to treat somebody with a cut. Next I have syringes. One is intramuscular syringes and other are insulin needles if you do come across someone who is diabetic and is needing that. Flushable wipes. You can clean your skin with this and also do other stuff if you are out and on the road and need to do it. All right, here we just have some little gauze. It's actually makeup removers, a N95 mask, and a little Fresnel lens to get real up close if you need to do something and you might not have glasses. Next thing we have is the Equate from Walmart's general brand, or what is this, Dayquil. And we also have Benadryl here for allergy stuff. Petroleum jelly and calamine lotion. Caffeine pills if you need to stay awake, and also alcohol prep pads if you need to clean a wound or disinfect an area of the skin for an injection. So I got these things. They're actually fishing tackle boxes, but they work great to hold any number of things. What I did was I placed everything in the trays, and then on top I labeled it with a label maker: laxative, aspirin, needle and thread, Band-Aids, thermometer, waterproof tape, hand lotion, acetaminophen, tons, dental floss, eye drops, allergy drops. Very easy way to organize things, and it fits in the bag. Perfect. We have another small fishing tackle box type kit, which I have, let's see, chapstick, super glue, finger splint, lighter, tweezers, and nail clippers. Never know when you're going to need those. All right, this here is a tourniquet. Tourniquets are great. Learn how to use a tourniquet on an online video, and it's basically a wrap around your arm and a twist, and it will cut off blood flow to a major artery being severed on your arm. I'm not going to get into instruction on this today. There are a lot of good videos about how to properly use and label a tourniquet. A splint. This is a arm splint. If you need to splint someone's break, it will form fit around their arm. It's basically a soft material wrapped around it's like a piece of bendable metal. Disposable skin stapler. Now, if you're out and you need to suture yourself or somebody, these things are awesome. Super easy to use too. Again, go on YouTube, find an instructional video about how to use a skin stapler. Basic medical scissors and some athletic tape. Pain relieving cream and sunscreen. Anti-diarrhea pills and a butterfly closure for a cut. Athlete's foot cream. Stomach relief, this is like Pepto. Itch relief cream if you get a bug bite or poison ivy. And hand sanitizer if you want to stay sanitized. Okay, here's something you might not think of. This is a rehydration substance, kind of like electrolytes. Now, a lot of people might get dehydrated or have some kind of low blood sugar. This will help them with that. The other thing we have here is Wound Seal. Stops bleeding immediately for minor cuts and scrapes. Okay, we got Sudafed here. You can get this legally. You just have to go into Walmart or wherever and show a driver's license, because they do make bad stuff, bad drugs with this. So Sudafed is something you might want to keep on hand. Also a little plunger if there's babies around and you need to get something out of their nose or their mouth or stuck in their ear. A good suction bulb would be good. Good old-fashioned Q-tips and Vicks vaporizing rub. Don't have to go into it. An emergency blanket. You might be dealing with somebody who has shock. You want to keep them warm. Emergency little reflective blanket. I also have fishing string. There's a lot of good uses for fishing string. You can sew up a wound with it, but it is good to just keep in your bag for a number of reasons. A headlamp. Very easy to operate. You put it on your head. It frees up both your hands. You don't have to mess around with a flashlight, and you have all the light you need. Paracord. Good old paracord is always good to have. Good old toothbrush and toothpaste. You could chuck that in here. Forget about it. And then duct tape. Duct tape has a million reasons. If you get the sniffles and you need to blow your nose. 2 jars of honey. Why do I have this? To get people's sugar stabilized. Honey is almost 0 expiration date. I have 2 jars in this. It's really good to get somebody's blood sugar back up if they're having a diabetic issue. Basic safety pins. And then this, moleskin. I have used this for more people on the road than I can count on one hand. Moleskin is really good for blisters on feet. Cold compress. These things, you just have to smash it. The 2 chemicals react and you get cold. And last, Captain Savaho has one of these tampons for people. All right, last thing is the medical bag inventory. I actually have this laminated. The front of it is every single thing I have in this bag, and on the back is what each item will treat. So I laminated this, and I actually keep this in my bag as a quick reference if I'm on the road, or if I need to say, hey, I have a headache, or hey, I have a sore throat, or hey, you know, I'm having itchy skin or whatever. I refer to this for what I need to use. There you have it. This is the bag I keep in both my car and a separate one at home. Yes, in the prepping world, 1 is none and 2 is 1. When I'm away from my home, 99% of the time, I've gotten there in my truck. So I keep this bag at all times in my truck. And to be completely honest, this bag has been the #1 prep I have continually used over the past several years. I've been places where someone needed a simple Band-Aid, like I said earlier, moleskin for a blister, Tylenol for a headache, or Pepto for an upset stomach. Yeah, I know it's not life-saving, but on a long enough timeline, I may need the sutures, I may need the splint, or I may need an EpiPen. Also, take a look at the extensive video I made about every single thing that I keep in my truck at all times. It's a great video that will get you prepared if you are far from home and you only have your car as a means for survival. I'll link it at the end of the video. Now that we have this all packed away, let's go over a few things of concern when storing a bag in your car or home. The first one is heat. If storing a bag in a hot car, the expiration dates on the medicine will be compromised. Every type of medicine I can think of states store in a cool, dry area. The biggest disadvantage of storing a bag where your car gets hot is that you'll need to replace the perishable medicines sooner rather than later. I'll swap out the tablets and the liquid solutions on a yearly basis. Bandages, gauze, tape, and other items will obviously keep for a very long time. 2, the bag I store in my home is kept in a cool, dry, dark area. I'm not concerned about the medicine spoiling, going bad, or becoming less potent than the label states. So let's go on and talk about expiration dates. Since 1979, the FDA required drug manufacturers to stamp an expiration date on all medications. This was said to guarantee the full potential and safety of the drug. Keeping your medicine stored in a cool, dry place can ensure that medicines last far beyond the expiration date, with the exception of nitroglycerin, insulin, and liquid antibiotics. Solid dosage forms like tablets and capsules are the most stable, far beyond their expiration dates. Drugs that exist in a solution or reconstituted suspensions, or that require refrigeration, are not as stable as the pill form. The expiration date should be adhered to more closely on these items. The FDA did over 100 tests on prescription and over-the-counter drugs and found that more than 90% of all drugs tested were still over 90% effective 15 years after their expiration dates. A study done by the Shelf Life Extension Program, SLEP, has a study that states 88% of over 122 different medications stored under ideal conditions recommended to have their expiration dates extended from 66 to 278 months beyond the stated expiration date on the label. That's 23 years. This means we could take expiration dates with a grain of salt. In ideal conditions, you should always strive to keep your medicines up to date to guarantee the effectiveness and proper dose. However, we are preppers and we look at the shizzy hits the scenarios where desperation may become a factor in getting medicine and medical care. Now let's talk about how to get a good supply of your prescribed medication. There are a few ways. There are several ways to create a good buffer in your on-hand medicine to assure that you have enough for a situation where supply lines tighten or you're worried about having a solid stockpile to get you through a longer-term scenario. The first, ask your doctor for a 3-month supply. Most doctors can fill scripts for 90 days, especially for medications that aren't highly controlled, like blood pressure medicine, cholesterol medicine, and other life-saving drugs. These are not highly regulated or abused. 2, fill your prescriptions early. In many instances, you can fill a 1-month prescription up to a week early. By staying vigilant and filling your prescription 1 week early will give you an extra 90 days of medication after only 1 year. Lastly, online purchasing. I won't get into this too much, but do your research on your own to see where you're able to purchase medicines online. I'll leave this out as to not get flagged. Let's talk about antibiotics next. Antibiotics, what are they? Antibiotics are used to fight bacterial infections. They work by killing the bacteria or by making it hard for the bacteria to grow and multiply. They are usually taken orally, but can also be applied topically or through injection. Common bacterial infections that antibiotics treat are strep throat, urinary tract infection, ear infections, E. coli, skin infections, sinus infections, gastrointestinal infections, and some STDs. Antibiotics are not for colds, sore throat, the flu, many gastrointestinal bugs that cause vomiting and diarrhea, and most cases of bronchitis are not treatable by antibiotics. In normal times, you will want to go to your doctor to get tested for the bacterial infection, then get a prescription to fight off said infection. But what about SHTF times? There are several ways to get antibiotics. First one, ask your doctor. Ask your doctor if they'll give you an on-hand supply of antibiotics for an emergency situation. Again, antibiotics aren't highly regulated and your doctor may offer a prescription freely. 2, what kind of antibiotics should you be asking for? There are several all-round antibiotics that will treat a number of infections if you cannot properly diagnose exactly what you may have. The kill-all or strongest main types of antibiotics are penicillin, flucloxacillin, if I said that right, and amoxicillin. Another way you can get these is online purchasing. I'm not going to give you the exact details of how to do that. I don't want to get flagged. Do your research. Side effects of antibiotics. Some people are allergic to antibiotics. If you've never taken a specific antibiotic before, you'll need to be aware of common side effects such as raised and itchy skin, rash, hives, or a cough. Penicillin is the most common antibiotic people are allergic to. The bottom line is that having antibiotics on hand can be life-saving. We take for granted the quick trip to the doctor's office to cure common ailments. That all stops if things get to the point where we need to be our own physician. Now for my extras that I keep in my medical supply kit. Because I don't only prepare for myself, I prepare for my neighbors, friends, family, and other people who I may come across. Some of these you may have a prescription for, others you may need to come across. The first one is an EpiPen. An EpiPen is used to treat anaphylactic shock. This is an extreme allergic reaction that can cause death by way of dropping in the blood pressure and then narrowing of the airways. Symptoms include a rapid, weak pulse, skin rash, nausea, and vomiting. Common foods, medications, stings, and bites from insects is what usually causes anaphylaxis. It can occur within minutes or seconds of an exposure. An EpiPen is an epinephrine injection used to immediately treat anaphylaxis. The second one is albuterol. Albuterol is used to treat bronchospasms or wheezing in patients with asthma. Albuterol increases the flow of air through the bronchial tubes. It can be life-saving if someone is suffering from a severe asthma attack. The third one I keep in my bag is alprazolam. It's used to treat anxiety and panic attacks. It works on the nerves of the brain to create a calming effect. Although alprazolam is not life-saving, in an SHTF scenario, anxiety and panic will be a concern for many. Alprazolam can act as a temporary calming agent for people who become overly stressed. All right, preppers, if you've made it this far through the video, I want to thank you for sticking around till the end. Also, please be sure to download the PDFs I mentioned earlier in the video. The links are in the description below. Be sure to like, subscribe, and leave a comment below if you found this video helpful. Now go out and start your medical supply kit so you can refuse to be a victim.